Welcome to Women's Health Weekly again from the women's health experts at Maiden Lane Medical. And as usual, we are trying to provide you expert health information so that you're not going out on the internet and finding things that may be inaccurate, incorrect, or simply fraudulent. And we really want to do our best as women's health experts here in New York City at Maiden Lane Medical to provide you with the best possible expert information about your health. So I've heard of also other types of pills. There are these super duper low dose pills.
Yeah.
Does that mean there's also a super duper high dose pill? And should I, as a patient, as a woman, want to avoid one versus the other?
These lower dose pills are kind of what we call these newer generation pills. Back in the day, so to speak, when pills were first created, they were created with much higher dose of hormones. And it's micrograms. It's really not that much more. I mean, we're talking micrograms of hormones. It's very small doses. But at those levels, that's what inhibited pregnancy. And over time, we realized that we can still give the same efficacy, meaning the same prevention of pregnancy with lower dose hormones, potentially less side effects on lower dose hormones. Why would we prescribe something higher unless someone comes to us with some side effects? You know, the biggest side effect of a lower dose hormone pill is that maybe your uterine lining kind of gets a little unstable. And so you might get spotting here, spotting there, annoying, not dangerous, not worrisome. It's just annoying. And so sometimes these low dose pills can give you a side effect of that unscheduled, erratic bleeding. And some women, believe it or not, even though most of us think of a birth control pill wiping out our periods altogether, giving no bleeding at all, some women, and I completely respect this, are not comfortable not seeing a monthly bleed for any number of reasons. And I get that. And these lower dose pills have a higher chance of wiping out your periods altogether. So for the woman that really needs the comfort of seeing a monthly bleed, sometimes we do have to raise to a higher dose. But again, it's a very small amount of estrogen that we're upping, so micrograms.
Tell me about implants, rings, and patches.
So if we're moving on from the pill, a lot of women are mentioned in the beginning of the pill that you have to take it around the same time. That's the other important thing. It can't just be you take it at 9 a.m. today and tomorrow you take it at 10 p.m. You're really supposed to take it around the same time every day for it to be the most effective. In general, for work, a lot of my patients travel to different time zones, travel internationally, and it's really hard to take it at the same time when you're 8 hours different, out in Europe or wherever. So the ring and the patch are still given by the patient. They're still patient administered. Us physicians do not need to place it for you, but you're not having to take it every single day. So the vaginal ring is placed in the vagina. Some women get a little nervous about it. Can I place it wrong? It's actually very easy to place. Unlike a diaphragm, which is a barrier method that is blocking sperm, this is still hormonal. So you place it in the vagina. It doesn't get lost anywhere. It can't go inside your abdominal cavity. The vagina is a closed entity, and it stays in for 3 weeks. And after 3 weeks, you take it out, and that's your period week, your withdrawal bleed week, and then you start it over again. And then there's the patch, and the patch is a little sticker. And most of my patients conceal it, in areas that underwear would cover. So either on the front of their pelvis or on their buttocks region. And that is something that you change once a week. And after 3 weeks, it's a patch-free week. You get your period, and then you start the process over. These are good forms of contraception for patients that still want control of their periods and the benefits of helping their periods without having to take something every single day.
We get a lot of questions about the implant, the
Yes.
rod implant that goes in the arm.
Implants that go underneath your skin, subdermal implants, it's just one rod. It's I describe it to patients, it's about the size of a matchstick. It's not very big. It goes kind of in your skin, right in your upper arm. If I'm just looking at your arm, you can't really tell that you have it there, so it is still concealed. This implant is hormonal. We talked about pills being mainly estrogen and progesterone. This is progesterone only, and it can stay in for 3 years. Nobody knows that you have it. It still helps with your periods. The biggest side effect of this one is that nuisancy bleeding. That's probably the number one side effect of the arm implant, but it really has been proven safe. It's very effective. I mean, this one is over 99% effective. There's no user error, and just of how it's working biologically, it's over 99% effective. It's really effective for prevention of pregnancy.